Hey guys, this is Dr. Hub. Today we'll look at the MI. We're going to see acute MI and the temporal evolution of the morphological changes. So first is we have the reversible injury. There is irreversible injury. So reversible injury, it occurs from 0 to half an hour, and the gross feature is there is none. So what about the microscopic features? The microscopic features, there is electron microscopy. So under the electron microscopy, there is a relaxation of the myofibrils. There is relaxation of the myofibrils, and there is also the glycogen loss. This presence of the glycogen loss. Next, there is also the mitochondrial swelling which is present. So the light microscopy, it is not significant. Then we look at the irreversible injury. So as far as the reversible injury was concerned, under the electron microscopy there was a relaxation of the myofibrils. So under the irreversible injury, we look at there is half an hour. There is half an hour to 4 hours. So in half an hour to 4 hours, the gross features is there is none. And the microscopic features, it includes the electron microscopy. Under the electron microscopy, there is a sarcolemma distribution. There is a sarcolemma distribution, and also the mitochondrial amorphous densities. Is mitochondrial amorphous densities. And from half to 1 hour, 4 hours, there is also in light microscopy. It is variable waviness. There is presence of variable waviness of the fibers. Variable waviness of the fibers, and this is at the border. Next, we look at the 4 to 14. So what's happening in the 4 to 14 hours? So in the 4 to 14 hours, it includes, there is the presence of dark mottling. This takes place from 4 to 14 hours. That is, it is occasionally it occurs. Now, what is the microscopic features? So, under the light microscopy, there is the early coagulation necrosis. There is early coagulation necrosis, and there is also presence of edema. There is the presence of edema as well as the hemorrhage. Then we look at the 12 to 14 hours, 24 hours. So 12 to 24 hours, there is also again the dark mottling, and under the light microscopy, there is presence of the ongoing coagulation necrosis. There is ongoing coagulation necrosis. Then there is also the pycnosis. This pycnosis of the nuclei. Next comes there is myocyte hypereosinophilia. There is myocyte hypereosinophilia, as well as there is presence of the marginal eosinophilia, there is marginal contraction, as well as marginal contraction band necrosis, as well as there is early neutrophilic infiltrate. There is early neutrophilic infiltrate. Next we move on to the 1 to 3 days. So within 1 to 3 days there is the mottling. So there is mottling, and this is with the yellow tan infarct center. There is a yellow tan infarct center. So let's look at the LM, that is a light microscopy. So here there is the coagulation necrosis. There is presence of the coagulation necrosis, and then there is also presence of the loss of nuclei. There is the loss of nuclei which is seen, and there are presence of striations. So there is loss of nuclei, there is presence of striations as well as brisk interstitial infiltrate. Brisk interstitial infiltrates. So this infiltrates is of the neutrophils. Next we look at the 3 to 7 days. So in the 3 to 7 days period, there is in gross there are hyperemic borders. There is presence of the hyperemic borders, and there is also central yellow tan softening. There is a central yellow tan softening. And now let's look at the LM, that is a light microscopy. So under the light microscopy, there is beginning disintegration of the dead myofibrils. There is beginning, and this is of the disintegration. So beginning of the disintegration, this is of the dead myofibrils. And there is also presence of the dying neutrophils. There is presence of dying neutrophils, as well as there is the early phagocytosis, and this is nothing but of the dead cells. Early phagocytosis of the dead cells. This is by the macrophages at the infarct border. Then we move on to 7 to 10 days. So in 7 to 10 days, that is just after week time, there is maximum yellow fan. There is maximal yellow. So there is a maximal yellow tan, and there is a yellow tan softening. There is a yellow tan softening. So how does the light microscopy look? So there is a yellow tan, as well as there is soft along with the depressed red tan margins. So the soft as well as there is red tan margins. Now under the light microscopy, it is well developed phagocytosis. There is well developed phagocytosis, and this is nothing but of the dead cells. And there is also granulation tissue at the margins. There is granulation tissue and it is present at the margins. Then we'll move on to the 10 to 14 days. So this is just before the 2 weeks. So 10 to 14 days, there is a red, grey depressed infarct borders. There is red as well as grey infarct borders. So under light microscopy, what do we have? So under light microscopy, this is for the 10 to 14 days. There is presence of the well established. So there is a well established granulation tissue, and this is along with the new blood vessels and collagen deposition. So they have your new blood vessels as well as presence of the collagen deposition. Next we move on to the 2 to 8 weeks. So in the 2 to 8 weeks, there is the gross feature being there is a grey-white scar. So finally in the end stage, there is going to be a grey-white scar, and it is progressive from the border. It is progressive, and this is from the border towards the core of the infarct, towards core of infarct. Next is the LM, that is a light microscopy. So here it is increased collagen deposition. So there is increase in the collagen deposition as well as there is decrease in the cellularity. There is decrease in the cellularity.